Hello, and welcome to another episode of Optimal Anesthesia, Navigating Surgical Care. Today, we're delving into the fascinating world of perioperative care, where precision and expertise are the name of the game. In this episode, we're going to uncover the pivotal role that corticosteroids play in this intricate landscape. These medications, with their diverse mechanisms of action, are like the unsung heroes behind the scenes, ensuring smoother surgical experiences and improved patient outcomes. So, whether you're a healthcare professional or someone preparing for surgery, stick around because we're about to explore how corticosteroids influence everything from inflammation control to immune response modulation in the perioperative setting. Let's dive in. We're diving into the superhero world of corticosteroids and their mission in the surgical arena. Picture this: you're in the operating room, and the body's inflammatory response is revving up like a high-speed train. Enter corticosteroids, like methylprednisolone or dexamethasone, the peacekeepers of inflammation. They work by suppressing the bad guys in the body's inflammatory army. Think of them as the cytokine commanders, interleukin-1 and tumor necrosis factor alpha. Corticosteroids swoop in and say, "Hold on, calm down, no need to overreact." They also put the brakes on immune cells that are itching for a fight. The result? A more controlled, less chaotic surgical environment. Now, here's the kicker: dosages can vary, but think 0.5 to 1 mg of dexamethasone per kilogram of body weight, tailored to the patient's unique situation. Let's delve into stress-dose steroids, a crucial support for patients with adrenal insufficiency or chronic corticosteroid use during surgery. These steroids, like hydrocortisone, emulate the body's natural cortisol, offering both glucocorticoid and mineralocorticoid effects. Pre-anesthesia, we administer 50 to 100 mg of intravenous hydrocortisone, followed by an ongoing infusion of 100 to 200 mg daily. Dosing is fine-tuned to individual stress responses and body weight. This strategic use ensures the body copes optimally with surgical stress.
We're diving into a crucial element of surgical preparation: preoperative corticosteroids. These superheroes play a pivotal role in preventing two formidable foes during surgery: bronchospasm and allergic reactions. Picture this: you're in the operating room, and the airway is like a delicate ecosystem. The slightest disruption could lead to bronchospasm, a sudden constriction of the airways, or allergic reactions. How do they work their magic? Well, corticosteroids are the pacifiers of inflammation. They quell airway inflammation and, like vigilant sentinels, they put a stop to the release of inflammatory troublemakers like histamine and leukotrienes. In essence, preoperative corticosteroids ensure a smooth and uninterrupted surgical journey, making sure your airways stay clear and calm. It's a fine balance, but with the right dose and timing, these unsung heroes help keep surgery on track.
Now, let's tackle a common post-surgery villain: nausea and vomiting. Our trusty sidekick, dexamethasone, comes to the rescue as a prophylactic shield. How does it work? Well, it's got a multi-pronged strategy. First, it cuts down on the production of pesky prostaglandins and inflammatory mediators, those troublemakers that often cause nausea. There's more. Dexamethasone also silences the nausea center in the brain, known as the chemoreceptor trigger zone. Think of it as a mute button for post-op queasiness. Typical dosage? 4 to 8 mg via 4, with adjustments tailored to the patient's weight and risk factors.
Now, when it comes to pain relief, corticosteroids are like seasoned superheroes. But what's their secret? They have a knack for inhibiting the release of several inflammatory substances that are the culprits behind those aches and pains. First up, we have prostaglandins. These are troublemakers that sensitize pain receptors and fuel inflammation. Corticosteroids? They're pros at suppressing prostaglandin production. Next on our hit list are the cytokines, like interleukin-1 and tumor necrosis factor alpha. These are heavyweights in the inflammation game, and corticosteroids can dial down their production, leading to less inflammation and, you guessed it, less pain. But wait, there's more. Corticosteroids also take on histamine. You might know histamine from allergies, but it can also rear its head during inflammation. Corticosteroids help keep histamine in check, which means less itching, pain, and discomfort. Then there are leukotrienes, those pesky lipid mediators of inflammation. Corticosteroids step in and say, "Not on our watch." By inhibiting leukotriene production, they contribute to reduced pain and swelling. Last but not least, corticosteroids can modulate chemokines. These are the signaling proteins that recruit immune cells to inflamed areas. By tinkering with chemokines, corticosteroids can help reduce the influx of immune cells, leading to less inflammation and, of course, less pain. So, there you have it, corticosteroids, the unsung heroes in the fight against pain, taking on a multitude of inflammatory substances to make sure you're as comfortable as possible. Today, we explore corticosteroids' artistic role in surgery, reducing scars and aiding autoimmune patients. Corticosteroids are like sculptors, curbing inflammation for subtler scars. They're also pacifiers for overactive immune systems, quieting immune responses. Precision is key, doses tailored to each need. As we conclude our exploration of corticosteroids in the perioperative world, it's clear these medications are versatile problem solvers. They tackle inflammation, pain, and immune responses. Whether calming inflammation, preventing allergies and nausea, or reducing scar visibility, corticosteroids are invaluable. But they're precision tools, requiring expert handling by perioperative healthcare providers. Remember, their use must be tailored to each patient. Thanks for joining us in the realm of optimal anesthesia and surgical care. Stay curious and well.